My name is Allison. Back in 2016, I was at a routine physical. My family doctor found lumps in my neck. He then sent me for testing. I subsequently found out that I had stage 4 squamous cell carcinoma at the base of my tongue. I had been having intermittent swelling off and on since I'd had radiation, and we decided to go on this trip with our friends about 3 months after I completed my radiation treatments. And while on the plane, my face and my neck swelled really big. When I came back to town, I had an appointment with my speech therapist, and she said, "You have lymphedema." Well, I didn't even know you could get it in your face or neck. As a traveling home therapist, I'd only seen it in extremities, and it was usually cancer patients or chronic venous insufficiency patients. So she immediately sent me to a lady named Cindy, and she coincidentally was an occupational therapist. She's the one who told me about the FlexiTouch pump. I'll never forget the day we did the pump trial. Prior to starting chemo and radiation, I had been working with a speech therapist. I was still taking tiny sips and doing a head turn chin tuck maneuver to swallow. And I'll never forget it. I'm in the pump and it's inflating, and all of a sudden I had a new awareness of the back of my throat that hadn't been there. And we got me out of the pump and I asked for a drink, and I was actually able to drink almost normal consecutive sips without doing my head turn chin tuck maneuver that I'd been doing. I was so impressed with the FlexiTouch after my pump trial that was just a partial treatment. After 15 minutes, I decided that I had to have this at home. The reason Cindy decided to try a FlexiTouch with me was in part because I had a lot of this hard, what we call radiation fibrosis tissue down here around my jawline. This just was not reducing as much as we had hoped, plus your tongue bone is under there. So I really wasn't manipulating food well. The FlexiTouch really is effective in this respect in breaking up that hard fibrotic tissue so that you have better tongue control and better drainage. So one thing I would like to tell the therapy community is pumps do work. So if you've been in therapy for a long time and you've heard about how pumps were 20 years ago, this is so not like those pumps. It's easy to use, it's easy to don. Your therapies are preset. It's plug it in the wall, plug in your hoses, and go. The way I usually explain this to my patients is most of us have had surgery and you've had the pumps on your legs after surgery so that you don't get blood clots. It's nothing like that. Those pumps pump hard. This is more of just some chambers inflate while others deflate at the same time, and it creates a wave-like motion that's very relaxing. I am convinced that one of the things helped in my recovery was early intervention speech therapy. This could so help the speech therapy community, especially when they work with head and necks, because we start swelling probably halfway into our radiation experience. I'm a lymphedema therapist, so some of the things I keep in mind when I work with my patients are I want them to be able to do self-management at home. There are no other head or neck pumps on the market. I know the success I've had with my pump, and I want to share that with my patients.